All right, we ready? All right, good morning, everyone.
Good morning.
And thank you so much for being here. We are here to give you an update on where we are as a city regarding COVID-19 and to put some recent news into context. Let me begin by recognizing the other people who are joining me here today. Of course, Chicago Department of Public Health Commissioner Dr. Allison Arwady, Chicago Department of Public Health Medical Director Dr. Geraldine Luna, Howard Brown Health Regional Medical Director Dr. Meyer Green, and Social Works Street Team Supervisor Kevin Young, who overcame his hesitancy and chose to receive a life-saving COVID-19 vaccine. Now I'm going to turn it over to Dr. Arwady to dig into some of the details and put some of the recent news in context. Then you will hear from Dr. Luna, Dr. Green, and Mr. Young, and then I'll come back at the end before we have questions. Dr. Arwady, I'll turn it over to you.
Thank you, Mayor. We will be posting these slides online right after the press conference so people are able to take a look for themselves at the data. So as you know, on Friday, the City of Chicago passed our 200 case per day mark, and in line with CDC guidance and CDPH guidance, we have recommended that all city residents and anybody in Chicago over the age of 2 should be wearing a mask regardless of their vaccination status. However, there has been a lot of worry related to breakthrough infections, and I wanted to really make sure folks had a good understanding of the risk and, importantly, how well the vaccines continue to work. So first of all, here's where we are on our Chicago community transmission matrix. I want to highlight we've made one change and one change only, which was to rename the central column, which we'd been calling moderate transmission. We're calling it substantial transmission because that's what the CDC calls it. But we have not had a single change to these cutoffs or to these numbers. We've been using them all along. So what we see is that here in Chicago, we're now averaging 206 new cases every day. And with that, crossing the 200 threshold, we move from the lower transmission to the substantial transmission. Our other metrics remain in the lower transmission category. Our positivity is currently 3.1%. We have approximately 121 people hospitalized across the city with COVID, not in the ICU, and another 42 in the ICU. Where we put these numbers into perspective, we have been enjoying well-controlled COVID over these last 2 months, especially because we have a lot of folks vaccinated. There were only 13 days in all of 2020, and that was in early June, when we had fewer than 200 cases per day. So it is not in and of itself that concerning that we've crossed the 200 mark. Certainly, we want to take care of each other. We want to help protect people like children who have not yet had the opportunity to be vaccinated, or older adults, or those who are immunocompromised and maybe at higher risk. But I want to remind you that we are not surging in a way similar to what we had seen in the first or second surge. And I expect we may see a surge. I expect we will see a surge, but it may be more like what we saw in our third mini surge in April, where most of those cases were in people who were unvaccinated. I also want to say very strongly that I know you may be hearing stories about people who have been fully vaccinated and have gotten COVID-19. That's called a breakthrough infection. It definitely happens because there is no such thing as a completely protective vaccine. But here in Chicago and across the country, 99.9% of vaccinated Chicagoans have not been diagnosed with COVID-19 since being vaccinated. 99.9% have not been diagnosed with COVID, and that holds nationally as well. Where we look at hospitalizations, again for some context, we're currently averaging between 8 and 9 new hospitalizations a day. And again, if you look over the whole pandemic, on the left side here, that's right at the beginning, where we were having as many as 150 people being admitted every single day to the hospital. The worst that we had, and by far the point where our health system was the most threatened. In the second surge, in November, December, January, as vaccines started started to come into the picture. You can see what the hospitalizations looked like there. But then again, in comparison, in this April-May timeframe, we saw a surge, but because of the vaccine, did not have that same risk of overwhelming the health system. Since January 2021, 97% of COVID-19 hospitalizations in Chicago residents have been in people who are not fully vaccinated. And again, for breakthroughs, 99.99% of vaccinated Chicagoans have not been hospitalized with COVID-19. And then finally, related to deaths, again, if we look across the whole pandemic, since January 2021, 97% of our COVID deaths in Chicago residents have been in people not fully vaccinated, and 99.999% of vaccinated Chicagoans have not died of COVID-19 since being vaccinated. And again, I want to highlight where we look at the surges here of deaths. During that first surge, when we had to shut down, where we were really worried about the health system, we were averaging 350 deaths per week, about 50 per day from COVID-19 in Chicago. During that second surge, it was about half that. We were averaging about 180 deaths per week and 25 per day. And through the third surge, I put parentheses because with vaccines available, we did not come close to overwhelming the health system. We were having about 50 deaths per week or 7 per day, and currently we are averaging 1 death per day. So again, numbers are on the rise. Delta is here. It's more than 80% of the cases that we're diagnosing. I expect we'll see some increase, but the vaccines continue to be highly protective, especially against severe illness. Here's just a visual of what this looks like nationally. If the green box here is representing everybody who has been vaccinated, that red box, that small little corner, represents people with symptoms who have had COVID. And then in the red corner, there's this little tiny yellow. That represents the people who have actually died. So this is not common, although it tends to get a lot of attention because it worries folks. And then in Chicago, again, if we just look since March, this is looking at the difference between the risk of COVID-19 diagnosis for people who are unvaccinated, partially vaccinated, or fully vaccinated. That red line shows, again, that surge we saw in March and April, where the cases were falling in people who were unvaccinated. That dotted line is people who were partially vaccinated, so it's essential you get both doses of the vaccine if you've had Moderna or Pfizer. And then that bottom blue line, people who are fully vaccinated. We see the similar pattern if we're looking in folks who are hospitalized. So similarly, the huge majority, you can see that blue line is actually close to 0. Again, we expect it to go up a little bit, but unfortunately, most of the people getting seriously ill with COVID-19, these are vaccine preventable infections. And then finally, here are the deaths, and you see that same pattern. We have administered more than 3 million COVID-19 vaccines just in Chicago. So if you've been waiting to say, I want to see more people get it, or I want to wait longer, the trials of the Pfizer vaccine, the big trials, have also now been going on for more than a year. We have not identified long-term side effects. Sometimes I hear people say still there have been thousands or hundreds of thousands of people who have died from the vaccine. That is just not true. I hear people say there are fertility concerns related to the vaccine. That is not true. I hear people say there are microchips in the vaccine. That is not true. Please, I encourage you, if you have questions, if you're reading things on Facebook, you're hearing from friends, please talk to somebody who has spent some time looking at this. Talk to a doctor, talk to a pharmacist, go to one of the websites for medical providers, or go to the CDC, go to the Chicago Department of Public Health. But please don't just take the word of somebody who might be posting something on Facebook, because there's a lot of misinformation. At least 40% of age-eligible Chicagoans, meaning over the age of 12, in every zip code in Chicago have had at least that first dose of vaccine, which is good. We're just about at 50% of our children in that 12 to 17 range getting the first dose, which we're pleased with. But if we look at the breakdown here, so on the left, every zip code in Chicago is shaded because this represents every zip code that has at least 40% of the folks vaccinated. As you move to the right, there are 6 zip codes in white on that zip code. You can see on the south side and then the Austin area on the west side. 6 zip codes that are at least 50% vaccinated, which is good, but not 60%. Then as you move to the right, we've got 13 zip codes that are at least 60% all but 13 zip codes are at least 60% vaccinated. Again, predominantly on the south side and on the west side where we're lagging a bit. For some context, I am very happy that most of this map is blue, but it needs to be higher. Where you're seeing major surges, there are many counties and parts of the US where fewer than 20% are vaccinated. It's a very unsafe situation. But particularly in the unshaded zip codes on these maps, on the right sides, those are areas where the risk is higher because there are more people who are still not vaccinated. In contrast, this is where we would like every zip code to be shaded. On the left, the dark blue marks zip codes where at least 70% of age-eligible Chicagoans are vaccinated with a first dose. You can see that's predominantly on the north side, also very nice uptick on the southwest side. The middle represents 80% vaccination. And you can see we don't have a lot of zip codes where at least 80% are vaccinated. And when we get to 90% vaccinated, you see it's just some of these very, very low population zip codes in and around the loop. So we have a long way to go. If the maps on this page were fully shaded in, we would be largely putting COVID behind us. So please, if you've not had the opportunity yet, get your vaccine. They remain available. We've been sharing the same information for months now. Completely free, ZocDoc.com/vaccine or 312-746-4835. Every Chicagoan is eligible for free at-home vaccination. We've expanded that capacity. We've got evening hours now. We can vaccinate up to 10 people at a time. You can choose between Pfizer or Johnson & Johnson. There is no identification required, no insurance required. You will not get a bill. So please call this number, and we'd love to bring vaccine to your house. Couldn't be more convenient, and you're doing your part to protect yourself. I just want to end by saying that in Chicago, we can be open and be careful at the same time. Being careful means getting vaccinated. When you get vaccinated, first and foremost, you are protecting yourself, although there is also some indirect benefit to others. And when our numbers are higher, like they are right now, not crazy high like they were last year, you put on a mask. When you put on a mask, you predominantly are protecting others, although there is also some benefit to yourself. Those two things working together help us be careful as a city and stay open. We have no goal or current plans to close down Chicago again. But we need people, please, once again, to step up. We've made it through this pandemic well so far, especially when you compare what happened right at the beginning to after we were able to get a lot of these mitigations in place. I know it's hard, especially for people who are vaccinated, to feel like they have to put a mask on. It feels like we're taking a step backwards. But when you do that, you help protect people who have not yet been vaccinated. And with some of this data that people can be vaccinated, but still potentially spread COVID, it helps decrease the risk for all. We don't have a way to know by looking at somebody whether or not they're vaccinated. And so it is not forever that we are making this mask recommendation for all. The most important thing, if you're going to choose between a vaccine and a mask, is get vaccinated. But then when you are in indoor public places, we ask you please to put that mask back on. It helps protect you, your family, and all of Chicago. Thank you. I'll bring up Dr. Luna now, who will provide some remarks in Spanish.